Hi, this is Leanna Kramer. I'm the acupuncture physician here at Peaks of Health. And I wanted to talk a little bit about myself before I get into the acupuncture health talk. I've been an acupuncture physician for over 25 years in the Tampa Bay area. I worked with Dr. Daofeng Li, another acupuncture physician, very famous in China, but I worked with him here in Orlando. And we saw a lot of stroke patients, a lot of neurological patients. I also worked at a couple of chiropractor offices here in the Tampa Bay area. So I saw a lot of pain patients, a lot of personal injury patients. I also worked with Dr. An. He is a gastroenterologist. So I saw a lot of digestive disorders, stress, anxiety, things like that. Here at Peaks of Health, we are a holistic center, so we see a little bit of everything. So I've gotten to treat a lot of different patients here, such as PTSD, Lyme's disease, addictions, weight loss, detoxing, and so on. So let's start the acupuncture PowerPoint. Acupuncture is a treatment derived from ancient Chinese medicine in which fine needles are inserted at certain sites in the body for therapeutic or preventative purposes. This is a chart of a foot reflexology chart. As you can see, there's areas at the bottom of the feet with every single body part, every single organ. So if I were to treat the neck, for instance, I would choose the point at the bottom of the foot to help treat the neck. I don't usually put needles at the bottom of the feet. I usually do acupressure, so massage at the bottom of the feet. And you could take this chart home with you and treat yourself at home by doing some massage as well. This is the ear acupuncture chart. And if you look at this chart, it's got every single body part, every single organ in the ear. And it kind of resembles a human embryo upside down, where the earlobe, there's the head points, and then the spine goes up, and then the internal organs are in the middle of this chart. The ear acupuncture I do use a lot, and I use a lot of the points for any kind of emotional problem, any kind of anxiety, stress, depression. I also use the ear points for any kind of addiction, weight loss, anything like that. So ear acupuncture is used a lot in my practice. The theory, traditional acupuncture is based on the belief that an energy or life force flows through the body in channels called meridians. This life force is known as qi. Practitioners who adhere to traditional beliefs about acupuncture believe that when qi does not flow freely through the body, this causes illness. They also believe acupuncture can restore the flow of qi and so restore health. Does it work? Currently, the National Institute of Health and Care Excellence only recommends considering acupuncture as a treatment option for chronic lower back pain, chronic tension type headaches, and migraines. They also say it makes these recommendations on the basis of scientific evidence. There's also some evidence that acupuncture works for a small number of other problems, including neck pain and post-chemotherapy, nausea, and vomiting. Acupuncture is sometimes used for a variety of other conditions as well, but the evidence is not conclusive for many of these uses. Who may be able to have acupuncture? Because of the slight risk of bleeding, people with bleeding disorders such as hemophilia or people taking medication to prevent blood clotting, anticoagulants may not be able to have acupuncture. If you have a blood disorder or are taking anticoagulants, talk to your GP before you have acupuncture. Acupuncture is also not usually advised if you have a metal allergy or an infection in the area where needles may be inserted. 25 years of practicing acupuncture, I've never had anybody problems with metal allergies or have a problem with the acupuncture needles at all. They're hair-thin needles. Before treatment, your acupuncture practitioner should ask about any underlying conditions you have or medication you're taking, as some of these may affect the treatment you have had. It's generally safe to have acupuncture when you are pregnant. However, you should let your acupuncture practitioner know if you are pregnant because certain acupuncture points cannot be used safely during pregnancy, and this is true for massage as well. How acupuncture is performed: typically an initial acupuncture session will involve an assessment of general health, a medical history, and a physical examination, followed by insertion of acupuncture needles. Most acupuncture sessions last between 20 and 40 minutes. Courses of treatment often involve up to 10 separate treatments, but this can vary. Acupuncture practitioners choose specific points to place the needles based on your condition. From 1 to 12 points will typically be used during the session, and sometimes more depending on a number of symptoms you have. The needles may be inserted just under the skin or deeper so they reach the muscle tissue. Once the needles are in place, they may be left in position for a length of time lasting from a few minutes to up to around 30 minutes. What does it feel like? You may feel a tingling or a dull ache when the needles are inserted. You should not experience any significant pain. If you do, let your practitioner know right away. In some cases, your practitioner may rotate the needles or stimulate them with mild electric current, known as electroacupuncture. And here's a picture of the electroacupuncture. And this is just a TENS unit that has alligator clips that clips onto the acupuncture needles. So you get a deeper and stronger treatment of the acupuncture. So it's not unlike having a TENS unit placed on your skin with a pad. This is actually clipped onto the needle so you get a deeper treatment. Mechanisms of action. Several processes have been proposed to explain acupuncture's effects, primarily those on pain. Acupuncture points are believed to stimulate the central nervous system to release chemicals into the muscles, spinal cord, and brain. These chemicals either change the experience of pain or release other chemicals such as hormones that influence the body's self-regulating systems. The biochemical changes may stimulate the body's natural healing abilities and promote physical and emotional well-being. There are three main mechanisms of action. Conduction of electromagnetic signals. Western scientists have found evidence that acupuncture points on strategic conductors of electromagnetic signals. Stimulating points along these pathways through acupuncture enables electromagnetic signals to be relayed in a greater rate than under normal conditions. These signals may start to flow of pain-killing chemicals such as endorphins and of immune system cells to specific sites that are injured or vulnerable to disease. The activation of opioid systems. Researchers have found that several types of opioids may be released in the central nervous system during acupuncture treatment, thereby reducing pain. Changes in brain chemistry, sensation, and involuntary body functions. Studies have shown that acupuncture may alter brain chemistry by changing the release of neurotransmitters and neurohormones in a good way. Acupuncture also has been documented to affect the parts of the central nervous system related to sensation and involuntary body functions, such as immune reactions and processes whereby a person's blood pressure, blood flow, and body temperature are regulated. These are some of the conditions that acupuncture treats. Of course, you have all the digestive conditions, all the emotional, musculoskeletal. The miscellaneous would be addiction control, athletic performance, blood pressure regulation, chronic fatigue, immune system tonification, stress reduction, eye, ear, nose, and throat, gynecological infertility, menopausal symptoms, PMS, neurological, respiratory. The risks and side effects. Acupuncture is safe when it's conducted by a qualified practitioner. Mild, short-lasting side effects do occur in some cases, however. Pain where the needles are punctured in the skin. Bleeding or bruising where the needles puncture the skin. Drowsiness, feeling sick, feeling dizzy or faint, worsening of pre-existing symptoms. So feeling dizzy or faint or things like that. And a lot of that has to do with, I have a massage table that I lay you down in, and a lot of people lay face down on the massage table. So some people get up and they feel a little dizzy just from the position that they're laying in. The bleeding and bruising, you will get maybe a little bruising here and there. And I see maybe one drop of blood. And the pain from the needles is very mild. This is a picture of cupping, and this is considered kind of the reverse of massage, where massage is pushing the muscles and creating more blood circulation in this area and calming any muscle spasms, things like that. This is actually suction cups that are sucking up the muscles and having the toxins come to the surface of the skin so you can easily sweat out toxins. So this would be used for any kind of muscle pain, things like that, muscle related. This is moxa, and it looks like a cigar, but it's an herb called moxa. And this would be used to heat up the needles to have a stronger effect of the acupuncture. It just gets near the top of the needle just to warm the needle up. I don't use moxa in my practice at all because the moxa herb has a really funny smell. It smells a lot like marijuana, and I don't like that in the clinic. So I use an infrared heat lamp instead to heat up the needles. And then this is the end of the slide presentation done by, and thank you so much. So now I'm going to have a patient come in. Her name is Bobby, and I'm going to give her a treatment. I'm going to treat her for stress. How are you doing, Bobby?
I'm stressed.
You're stressed. Well, I'm going to swab a couple of points with alcohol.
Okay.
There's some in your ear as well. And I'm going to use one of our tiniest needles. To put the needle in the forehead here. Very tiny. I don't know if you can see that, but we'll have Bobby, once I put all the needles in, put her face a little closer to the monitor. Okay, that is one. Did you feel anything, Bobby?
Nope.
All right. The next one is going to be in the ear. And these are all really good stress relieving acupuncture points. When I put the needles in the ear, they stay in for about 20 minutes. I put some nice music on, a nice heat lamp on you. A lot of people just fall asleep. After 20 minutes, I take them out. And then I would replace these needles in the ear with ear beads. And that is a tiny little ball attached to a piece of tape. So this would serve as acupressure. So after, there we go, there's tiny little balls attached to a piece of tape. After I take the needles out, I would put these in place, and then I would tell Bobby to go home and massage those actual seeds or little balls. And you keep them in for 3 to 5 days. You massage them 10 times a day, 10 seconds each time. After 3 to 5 days, you just peel them off and throw them away. Now there is one more point I want to do at the top of your head. And this one is really good for stress. That's really good memory point as well. Feel all right?
Mm-hmm.
Okay. So when I was taking my acupuncture boards 25 years ago, I looked around the room and everybody had this point sticking out of their head. So their memory would be good taking the acupuncture boards. So do you want to get up a little bit closer? Show your ear. The other ear, yeah. What did you feel like when I did the head point?
It just felt like a little bit of a tingle.
Yeah.
Nothing painful.
So it's not like getting a tattoo or anything?
Oh, no. It's just more like
Acupuncture is nothing like tattoos,
nothing.
pricking your finger for diabetes, getting your blood drawn, nothing like that.
A mosquito bite hurts more.
A mosquito bite hurts more, yeah. They're very hair thin, so they're very mild. So when the acupuncture needle goes in, you don't really feel much, but your body thinks something is going on.
Mm-hmm.
So your body severely reacts to this invasive object in your body. What is that? Let's get rid of it. Send the reinforcements. Let's repair in that area. You don't feel anything, but your body thinks something's going on. But so I can get pinpoint accuracy of where I want your body to heal itself.
Okay.
So that's what acupuncture is doing. I'm training your body to repair itself.
So Dr. Kramer, we have a question for you. This is from Levi, and he asks, what are some good questions to ask a potential acupuncturist to determine if they are legit or a fraud?
Well, you would want to ask where they went to school. You would want to ask, what their policies, their clean needle technique would be, because, you're supposed to only be using disposable needles, everything.
Which you have here, right? Could I hold them up a little bit closer
sure.
so people could see them?
So they're all prepackaged, all disposable needles.
And that's what it should look like if it's legit, right?
Yes.
They should have these.
And, what patients they have seen in the past, and, how many times how long they've been a practitioner as well. So the longer you've been out there, the more different types of diseases you've seen.
Right. So that experience really matters to how effective the acupuncture treatment is.
Yes.
Okay. So you are a resident acupuncturist right here at Peaks of Health.
Yes.
And we see a little bit of everything. And what do you think the acupuncture here is really treating for our patients?
Well, yes, we see a little bit of everything. So we see a lot of patients that, regular Western medicine do not know what's wrong with them. And so, a lot of different, chronic fatigue syndromes, fibromyalgia, digestive disorders, Lyme's disease, real tough cases. So I am working in conjunction with the DO doctors here on maybe some symptoms that they're having. So the doctors here are trying to get rid of the disease, whether it be Lyme's disease, but there's a lot of symptoms you have from Lyme's disease. You have chronic fatigue, you have pain, things like that. So I'm going to be treating the symptoms that they have.
Okay. And speaking of treatments, how often should you get acupuncture treatments?
Everybody's different, but I usually have them come in 1 to 3 times per week for a series of weeks, for maybe 4 weeks. And then we do a reevaluation. And then it can go down to once a week for a series of weeks. And the goal is to just come in 4 times a year for a tune-up.
Okay, so it's like the maintenance. Once everything is fine, or what if I don't have any problems, but I'm interested in trying acupuncture? Maybe I would do it 4 times a year.
Oh, yes, definitely. Just for a tune-up.
Okay. And are there any, age limits? Too young, too old to get acupuncture?
Normally, I will not do acupuncture on kids. I do more acupressure for them. So, just because kids don't really like needles too much, so I would do more acupressure for them. But, 12 and up, no problems.
12. Okay. And how long is each treatment? I know you touched on it during your presentation, but could you go over that again?
Sure. You'll be with me for about 45 minutes. So I'll go over what's going on with you and do the treatment, but you'll actually have the needles in for about 20 minutes.
Okay. And you will sometimes do the electro one too?
Yes,
What's it
electroacupuncture.
Electro.
Yes. And that's just basically causing a little vibration to the needle to help stimulate the point, because you want your body to react to these acupuncture needles. They're so hair thin, your body is reacting to them, but with the electricity, your body severely reacts to them to repair. So just like if you broke your arm, what is healing that bone? Is it the cast? Is it the pain pills? No, it's your body. Your body repairs that bone. So acupuncture helps your body repair itself. I can get pinpoint accuracy of where I want your body to repair.
So we have another question. This is from Tony, and he says that he couldn't be here for 4 sessions over the 4 weeks. Is it worth it for him to come in for just one visit? And he's saying it's because he comes in and out of town, won't be back till September. So is it worth it just for one visit?
It depends on what he's coming in for. But it would behoove him to find another acupuncturist in the area where he's at to get a follow-up treatment, because I can help stimulate the body to repair itself, but then it's going to die down and I have to stimulate it again the next couple days. So what we need to do is keep it going, and then after a while you only probably need it 4 times a year.
4 times a year, not 4 times a week.
Right. At the beginning, it would be 3 times a week,
Okay.
1 to 3 times a week for 4 weeks, and then we do a reevaluation. But the goal is to get it down to just 4 times a year.
So it's sort of like finishing a course of medicine, right? Like you can't start it and just take one pill and then expect it to go away. You have to take the whole set.
I mean, it's going to, I had a patient come in and he had upper neck pain, shoulder pain for 15 years. I gave him 1 acupuncture treatment and it was gone. He didn't have pain after that. That is kind of rare, because normally you need a series of treatments, but it can happen.
Wow. So I was going to ask you then, what is your success stories that you've had with people, as much as you can say with patient confidentiality, what are some examples of some successes?
Well, with infertility, for one thing, people are, the women are able to have babies after the acupuncture treatment, after a series of treatments. I have treated some pregnant women to help stimulate the birth to come on, so they can have, if they're overdue on their due date, things like that. A lot of pain patients. Acupuncture works really well for pain and stress, depression, anxiety, and addiction. So if you want to quit smoking or weight loss, it works really well.
Interesting. Now, could you, if you were someone getting treated for a chronic condition with acupuncture, would it help to also do the acupressure on yourself at home as like a complementary thing?
Yes, you can do that, and it is a complementary thing. But just know, like, if you were to give yourself massage at home, it works, but it's not as good as being in a facility, having the lights down low, being de-stressed, having the phone away, having the kids away, getting the acupuncture needles, let the needles do what they're supposed to do. So having the acupuncture physician treat you, and that's what works best with the invasive needle. But the acupressure at home, that'll help, yes.
Interesting. So I think we have a special going on, right, to the end of the month. Do you want to talk about that?
Well, I don't know. Do we have a special going on?
Yeah, 20% off for the new patients for acupuncture if they sign up by the end of the month. If they schedule it by the end of the month, they get 20% off their first treatment.
Good, yes. I love specials. So. I'll do one every week. That's fine with me.
Yeah, or, get the employee discount. Right, Bobby?
Right.
How are you feeling, Bobby?
Good, yeah. I'm just relaxed.
I can just take out the needles if you want to see that.
Yeah, that would be a treat.
It's easy peasy. There's one. Sometimes you'll get a bleeder, sometimes not. And that's why I went into this medicine instead of surgery. I only see 1 drop of blood. And that's good with me. You are not a bleeder. You're good.
I have blood in my body.
Yes.
It stays there.
It likes to stay in one place.
All right. Well, do you want to sign off? Say goodbye to everybody?
Well, I hope I see you soon. Take care.